Hi, everyone. I'm Steve Freedland, a urologist at Cedars-Sinai Medical Center in Los Angeles, California, as well as the Durham VA Hospital in Durham, North Carolina. And it's exciting to be here today with you with Data Oncology Advisors with my close friend, Dr. Farnoosh Nik-Ahd, who is a urology resident at UCSF. So welcome, Farnoosh.
Thank you so much. Thank you, Steve, for having me. It's a pleasure to be here.
Yep, no, absolutely. It's always a pleasure to talk to you. And first and foremost, congratulations on now being a chief resident in urology.
Exciting times, exciting times. Thank you.
Yeah. So, and while still a resident, really doing spectacular work. So very, very impressive. Congratulations on all your successes. And we're here to talk today about your latest paper that was published in JAMA just a few weeks ago. But give me a little bit of a background, kind of, you had published a paper a year ago in JAMA on transgender women and prostate cancer. So kind of let the listeners, let's do a quick recap of what you found, and then what was the kind of unanswered questions that led to this latest paper?
Well, first, thank you for the very kind words. And we have an amazing team that makes it all possible, including you. So thank you for the mentorship, and a shout out to our team as well. So in our last paper, we found that prostate cancer in transgender women actively on estrogen was more aggressive at the time of diagnosis. And that was compared to transgender women who were not on estrogen or who were formerly on estrogen, and also compared to cisgender men. So it led us to asking the question, why? Why are transgender women on estrogen presenting with more aggressive disease? And are there potential delays in diagnosis? And we thought a bit about what some of those potential delays in diagnosis might be. And an important one might be that the PSA reference ranges that are currently in use are not appropriate for transgender women on estrogen. And that would result in diagnoses getting missed.
Why would PSA values be lower on transgender women on estrogen?
Yeah, it's a great question. So transgender women on estrogen would be expected to have a castrate environment, meaning that the estrogen results in castration functionally. And PSA is an androgen-dependent protein, and so its production would be reduced in the presence of castration. So we would expect that PSA values in those on estrogen, and perhaps even other forms of gender-affirming hormones, would be markedly lower.
Had there been prior studies that had looked at exactly how low it is?
It's interesting. There aren't prior studies in transgender women who are on gender-affirming hormones to look at how low it is. And that's actually exactly what we tried to do in this paper, to figure out what are PSAs in transgender women who are on estrogen. And we specifically focused on estrogen because that's the most common form of gender-affirming hormone therapy that's in use. And so that's exactly what we tried to accomplish.
So before we jump into the results, which always everyone wants to hear what you found, tell us a little bit about what you did. Help us understand that the methods of this really important paper.
Yeah. So for this paper, we use the Veterans Health Administration, so the VA health system. And we specifically chose that as our data source because it's a national database. It has longitudinal data over time. And we've previously shown that there's actually a high number of transgender women or people who we think are transgender women in this cohort. And so we looked at people who had an ICD code related to transgender identity between the years 2000 and 2023, and people who did not have a diagnosis of prostate cancer. So those were the two criteria that we used. And then we chart reviewed 1,000 patients who were randomly selected, looking for specific inclusion criteria. And what that meant was that they identify as a transgender woman whose age is 40 plus, that they don't have a diagnosis of prostate cancer, meaning we don't know of any known prostate cancer in that person, that they're on estrogen, regardless of their orchiectomy status or regardless of the use of other forms of gender-affirming hormones, and that they had had a PSA test performed at some point between ages 40 and 80 after they had been on estrogen for at least 6 months. And that 6-month time point for the estrogen came based off of data that we have from finasteride or 5-alpha reductase inhibitors that shows that PSA is impacted after someone has been on those medications for 6 months. So that's why we chose that specific time frame.
So of the 1,000 charts reviewed, sounds like a lot of work. How many ultimately qualified for the study?
Yeah, so we ultimately had 210 people who were confirmed to identify as transgender women who met the other inclusion criteria for this study.
Okay. And so they all had to have at least one PSA, right?
Yeah, in this cohort, the 210 women had 852 PSAs in total.
Okay. So, because that's one of the questions, obviously, is are providers aware and even ordering PSA tests? Are you able to estimate how common that is from this, or not really?
Yeah, it's something that we hope to do. We're not able to estimate it based off of this study exactly, but it is something that we want to look at, and it's a great question because a part of why prostate cancer might be missed in this population that's also important and is very addressable is, are people even aware that transgender women are at risk of prostate cancer and that they should be considered for PSA screening, much like you would cisgender men?
That makes sense. So, all right, the final reveal here, the big reveal. So what did you find in terms of the PSA values?
Yeah. So what we found was that overall the PSA values are very, very low. The
How
median
low?
the median PSA value was 0.02. And the 95th percentile, and I specifically say the 95th percentile because often that's used when we think about potential cutoffs for screening markers. The 95th percentile in this cohort was 0.6. So when you think about it, way lower than that cutoff of 4 that's traditionally been used for people to be considered for further evaluation. And the 0.02 value, when we compare it to cisgender men of similar age, is about 50 times lower than values in cisgender men.
50 times lower. What do we know about the benefits of PSA screening for transgender women?
Yeah, it's a very, very important question. And the answer is that we don't really know yet. And so we need additional studies to figure out what are the risks and benefits of PSA screening in this population. And if there are benefits, what is the best way to screen transgender women? So it's definitely something that our group hopes to take on. And so stay tuned for more.
Well, that's great. So for that transgender woman that is getting a PSA test done, given that we don't necessarily know the value, but your data showed that it is happening. What advice should you give to the clinician or the patient out there? What can we give them a magic number that they should start worrying about?
Yeah, I think at this point it's too early and we can't give them a magic number, unfortunately. But our group would like to, do additional studies to figure out what should that cutoff be for this population, because what we know is that it's not 4. And so what I would say for now is to all clinicians and to patients, and especially clinicians, to think very clearly and carefully about what a PSA value in a transgender woman really means, and to interpret the value with caution, because it's not going to be 4. That's way too late to refer someone. So if you think that it might be high for somebody on hormones, have a lower threshold to refer them for further evaluation, and just be cautious about how you think about a PSA test. In transgender women who are on hormones, normal based off of our current standard is not necessarily normal, and it can provide a lot of false reassurance.
So what are the next steps? Where are you going with this?
Yeah, the next steps are to figure out what the proper cut points should be in transgender women who are undergoing PSA screening, and to think about what is the best way to screen this population. How do we provide that education to clinicians who care for transgender patients? And how do we go about this in a way that's thoughtful, that doesn't stigmatize patients further? And ultimately, how do we provide the best care that we can to a population that's been really marginalized and discriminated against for forever?
So even though we don't have a magic number, do we have strong enough data now to get something in the guidelines to warn people that, hey, PSA values may, not be what you think they are?
I think what we can say and that what we hope to have in the guidelines is that transgender women on estrogen are still at risk of prostate cancer, that they should still be considered for age-appropriate PSA screening, and that their PSA values should be interpreted with caution. And that number 4 is far too high of a cutoff to use in this population. So to really urge clinicians to interpret the PSAs with caution.
Did we miss anything? Is there any final thoughts or other, something I didn't ask?
I don't think so. I think it's, it's really exciting work for our team. There's a lot of different things that we hope to accomplish next. And so this is just the beginning from us.
That's great. Well, thank you so much for being here. As always, it's a pleasure to talk to you. And I don't know many residents of any in the country as a resident now having two first author papers in JAMA. So congratulations to you. Really outstanding, stellar work, Farnoosh.
Thank you.
And
Thank you. Appreciate it. Thank you again for the opportunity to be here to share our work. And a huge thank you to our team who makes this all possible, and looking forward to all the next steps that we have.
well, thank you so much for being here. And again, for the listeners, thanks for joining us today. Steve Freedland, a urologist, talking with my close friend, good partner, Farnoosh Nik-Ahd, about her latest findings that were published in JAMA about PSA values in transgender women on estrogen. Thank you for joining us today.
Thank you.